Reflux. Gastroesophageal reflux. Standard medicine: elevate the head of the bed, avoid food and drink for 3 hours before bedtime, decrease fat in the diet, avoid cigarettes, alcohol, lose weight. All of these things are helpful. But what they want to do is alkalinize the stomach because the reflux is causing the acid to come up. The esophagus cannot handle that acid. The acid comes up and the esophageal tissue actually changes so that it can tolerate that effect of the acid. So the tissue changes, and we don't want that to happen. So their contention is, let's neutralize the acid so when the gastric contents come up, it isn't quite so harmful to the esophagus. And let's also reduce the amount of acid production, so put Prilosec and any number of other acid blockers so the acid is not produced. Unfortunately, although it is a minority, there are some patients who have acid reflux because food is not being digested because of inadequate acid, and so they're having reflux because of that. And then standard medicine, without knowing that, will place the patient on, have less acid, and which makes the problem worse. Surgery, Nissen fundoplication, where they're actually taking the stomach, pulling it up around the esophagus so the stomach is smaller and has a small constriction of the esophagus. What do? I found that carbohydrates is a huge cause of acid reflux. Drop the carbohydrate intake, a lot of people don't have the acid reflux. Some other patients have told me that meat proteins cause more acid reflux in them. So there's a little bit of experimenting that needs to take place, see if we can reduce it. We use an oil, a vitamin E oil. This is not the real high quality extracted oil that the vitamin E capsules are coming in and that we take with our multivitamin. This is another form of vitamin E that the body doesn't need. It's less expensive. Swallow it. It coats the esophagus so the reflux isn't as harmful to the esophagus. Deglycerinated licorice. I'm still working on that pronunciation. I used to pronounce it deglycerinized licorice, and then I looked at it. I'm leaving out a whole bunch of sounds in there. Deglycerinated licorice. I like DGL much better. So it does improve peptic ulcer disease. If there's ulcers, it will help heal the ulcers without having to decrease the acid. In fact, in a head-to-head study with Tagamet and Zantac, DGL wafers were more effective for long-term relief and long-term resolution of the actual ulcers based on actually looking at the stomach and doing the x-rays. Add stomach acid if there's low stomach acid. That's the solution to that. Add pancreatic enzymes if they have a pancreatic enzyme deficiency.